Hi, everyone. I'm Dr. Samantha, the maternity mentor. Welcome back to another one of our live Q&A sessions that we have here every Monday at 9 p.m. Eastern Standard Time. This is a chance for you guys to interact with me and for me to interact with you and answer some of your questions live. So if you have any questions, please feel free to put them into the chat. This is also a chance for me to answer some of the questions that you have submitted onto our videos this week. So I'm going to be getting to some of those. Remember, we're on Facebook, Instagram, and Twitter for additional content. Please like and subscribe to the channel. Subscribing is really important, and hit the notification button so that you can get notified when our latest videos come out. And I will be making sure that we let you know about some of our videos coming up, including our video that's coming up tomorrow. So I'm going to go ahead and I'm going to get started with some questions that you guys have asked on the videos this week. But remember, please feel free to put stuff into the chat. So we get a lot of questions. And the first question that I wanted to talk about was actually a question about inducing labor. So we had a viewer who said, I just had discharge from one nipple last night. Should I try to pump to induce labor? So this was a great question, and I think it's a good way to start tonight. So our bodies start to produce colostrum. Colostrum is the first milk in the 5th or 6th month of pregnancy. Everybody's a little different. Some people could actually be later than that. And that first milk is there for when you have your baby. So it is very possible for you to start to see discharge at any point in time during your pregnancy from there on out. Now, just because you see this does not mean that it's time for you to have the baby. It does not mean that you're ready to have the baby. It simply means that this is just ready and there for your baby when you do deliver. Now, why is this so important? So for the longest time, everybody used to talk about how a mom was full term when she got to her last trimester. You heard 37 weeks, 38 weeks, and everybody's like, oh, she's ready to have the baby. We now know that that's not the case. In fact, you're not considered full term until you're 40 weeks pregnant. And we don't start considering inductions anymore until you're 39 weeks pregnant. And really, we try to wait if we can, unless there's a medical reason. Now, some people will have an induction earlier than that, but that's rare, and it's usually for a medical issue. So the reason why you're no longer considered full term if you're before 39 weeks is because your baby still has a lot of development that needs to take place. So in the last 4 weeks, that was starting at that 9th to 10th month, from 36 weeks to 40 weeks, a significant amount of brain development happens. And that brain development is very much related to suck-swallow coordination, to blood sugar regulation, and also to suck-swallow coordination, okay? And I'm sorry, and also to thermoregulation, regulating the baby's temperature. In addition, every week during the last 4 weeks, your baby could gain up to a pound in weight. Now, that pound of weight seems like it's not so important, but it actually is. For example, most of you guys know I'm a lactation consultant. And so I absolutely support breastfeeding moms, but I also support bottle feeding moms, including formula feeding moms. Whether you're breast or bottle feeding, in order to have proper suck-swallow coordination, there's a couple of things your baby needs. And one of those things is those chunky cheeks. So those chunky cheeks are super cute, but those chunky cheeks actually serve a purpose to allow the baby to create the suction that's needed in order to feed properly. So without those fat pads up in the cheeks, it can actually be harder for your baby to eat. In addition, your baby develops all this brown fat, which is what the baby will metabolize to help keep the baby the baby uses that fat for calories while your breast milk supply is building up. So if your baby doesn't have that extra fat reserve, your baby is not going to be able to maintain themselves without additional supplementation. And of course, without that extra fat, it's hard for you to also maintain your temperature. So these are all really important factors as to why you want to make sure you're delivering after 39 weeks. Now, just so you guys know, if any of you guys have a preterm baby, that brain development still will take place outside of your belly, but of course, it can cause some other issues. Now, when we're going to this question where she saw some discharge, should she start inducing labor? Really, you should never induce labor without talking to your healthcare provider first. Pumping to induce labor is fantastic for a lot of reasons. Amongst other, you can save that colostrum, put it in the freezer. As long as it's labeled properly with the date and time, you can actually use that to help feed the baby in the hospital if your breast milk supply is a little delayed coming in. But you don't want to start pumping to induce labor if, say, you're 37 weeks pregnant, because you could be inducing labor on a preterm baby. So what I'm going to say to this particular question is, no, you should not be pumping to induce labor just because you see discharge. Instead, you just want to talk to your healthcare provider and ask them what they think about the whole thing. Hi, Chanel. Okay, do they do a paper smear and pelvic exam to induce labor? So neither one of those would induce labor. Those would be done to check for labor. So I'm going to assume the paper smear, there's one of two things that I could think of that you're talking about. One is there's like a litmus test type of paper that we will lay against the vaginal wall to see if the secretions are actually amniotic fluid. So it turns a certain color if the pH is different, which it's more like the pH of amniotic fluid. So that's one thing. The second thing is they sometimes will gather a bit of the pelvic discharge and they'll smear it onto a slide and they look at it under the microscope to look for a particular pattern. That could also tell us whether the discharge is actually amniotic fluid or not. Both of those are not used as much anymore. We now do a particular test. It's called a ROM plus, where we, again, gather secretions, but it's sent to a lab and it's tested just like you would test like blood or stuff to see what type of fluid it is. That is not to induce labor. That's to check to see if you're in labor. Now, pelvic exams. Pelvic exams are when we're going to go ahead and we're going to usually use our fingers with the sterile gloves. We're going to put them inside the vagina and we're going to feel to see where the baby's at. So we're going to be checking our cervix. So remember, you've got the uterus. At the bottom is the cervix. Cervix is long, it's thick, and it's closed. So we're checking to see if it's like this or if the cervix is starting to thin out, if it's dilating, etc. So that's what a pelvic exam is for. Now, sometimes in your OB/GYN's office, what they will do is they will sweep the membranes. And I'm pretty sure we have a video on this. We're going to look and see if we can link this into the video. But what we have is that basically if you're at least 1 centimeter dilated, what your provider will do is they can stick a finger in and they sweep underneath the membrane. So you have the uterus and inside is your baby in the amniotic sac. And eventually over time, the amniotic sac will kind of settle against the uterine wall. And there's a little bit of membrane there, right? So stripping the membranes means that what they're doing is they're running their finger in between the amniotic sac and the uterine wall. And they kind of just like release that. So it can actually be a little painful and it can cause some spotting or bleeding. But when that happens, it releases some prostaglandins, which are hormones that send a signal to your body that you're in labor. So within 10 to 12 hours, we'll actually start to some contractions and we'll start to go into labor that way. So when you say pelvic exam, that might be one of the ways a pelvic exam could be used to induce labor, which is stripping the membranes. So good question. All right. So this week we had a question on carpal tunnel syndrome. I'm 35 weeks pregnant with my first baby, and the whole time I couldn't get sleep without my fingers and hands getting numb. I thought it was radiation on my phone, but now I know it's carpal tunnel. Now what do I do? Okay, so carpal tunnel syndrome is extremely common during pregnancy. And for those of you who aren't familiar with it, please feel free to take a look at the video. Now, what is it? This is the carpal space of your wrist, okay? So this space, if it gets, what happens is we have a small space with a band of tissue here. And your nerves that feed your hand, they come up through this space and then they branch out, okay? Now, when we don't have good basically like positioning of our hand when we're doing all this like computer work and we're putting a lot of pressure, it puts pressure on this space, okay? And over time, compression of that will irritate this, making it more swollen, but it also compresses the nerves, which causes this pins and needles feeling, and it can also cause numbness and pain. That's usually carpal tunnel syndrome. Now, the other thing that can make this worse is that if you're swelling, because a lot of women towards the end of their pregnancy especially will have a lot of swelling. So if you're having a lot of swelling, well, swelling in here also is going to make this space have even less space, right? So more compression. So carpal tunnel syndrome can cause severe pain. It can cause you to not sleep at night. It can cause you to not be able to hold things depending on how severe your numbness is. It can be really disruptive. Normally, outside of pregnancy, you would go to see a hand specialist who would examine you, and oftentimes you'll have a little tiny surgery. So it's very mild, but it is surgery. And what they do is they come in here and they just basically cut that little band of tissue so it opens up the space. And now all of a sudden, because it's open, the nerves are no longer compressed, and voila, it's all done. Okay, super easy. The problem is when you're pregnant, nobody is going to do that. They're not going to do a surgery, which is considered basically a want, not a need, while you're pregnant. They're not going to expose you or the baby to anesthesia. Now, in the meantime, what can you do? For starters, a lot of people, if their carpal tunnel is mild, will use braces. Okay, they'll put a brace on their hand to kind of keep this stable and to help with that pain. So that's one of the things that may be recommended. Now, you can buy a whole bunch of braces online, and I want you guys to know that that is possible, but you want to make sure that you are actually getting the right brace for carpal tunnel. So I usually suggest that you see the hand specialist. Now, that's the next thing you can do. You can see the hand surgeon. Here's the thing. If you're going to need surgery, you've got to get in with a carpal tunnel hand surgeon, right? Well, that could take a little bit of time. So even though you are pregnant, you can go in there to get started, meet the surgeon, ask the questions, figure out what it looks like, what's the recovery, because you have to make decisions about, when do you want to do this? How do you want to do this, etc. The other thing is that same hand surgeon can also potentially recommend for you to go to occupational therapy. Occupational therapists are like physical therapists, but for your hands. So they can help teach you some exercises and stuff to help make your wrists feel better. Now, the other thing is for this mom in particular, she says she's 35 weeks pregnant. The nice thing is she's almost at the end. So for any of you who are in the third trimester experiencing carpal tunnel syndrome, just know you're at the finish line. And once you have the baby, a lot of times the carpal tunnel also resolves. Especially if swelling is a big part of the issue and, the extra blood volume pregnant women have, all of a sudden you feel a lot better. So, fingers crossed that hopefully that's what it is and it can help you feel better right away. Do they do a pap smear and pelvic exam? Yeah, no, they don't do a pap smear to Chanel, to induce labor. And the only thing, specifically, sometimes at the very end, you'll have a pap smear where they'll do like a swab to make sure you haven't developed any kinds of infections right before delivery. They definitely do the GBS swab a lot of times around 36 weeks. That's the Q-tip where they'll put it near the anus and the vagina to make sure you don't have GBS bacteria, because then they'll treat you with antibiotics during labor. But no, neither one of those induce labor. Okay. So for many of you guys, you may know that I practice in psychiatry, and I'm very passionate about moms who are pregnant and postpartum being able to take medication if they need it. So we got a couple questions on my depression and pregnancy video about medications. So the first two are kind of combined together. One of them says, I've been taking fluoxetine 10 milligrams for 7 months for anxiety. I am 5 weeks pregnant now. Can I still take it or should I stop taking it? The next one was, I was on Prozac to treat a moderate to severe level of OCD. OCD is obsessive compulsive disorder, before getting pregnant accidentally. At 6 or 7 weeks, my doctor switched me to Celexa, which is also called citalopram, and cut the dosage in half. I decided I wanted to wean off while pregnant. It's been going okay. My family has been making me feel so guilty about it, as if I'm hurting my baby and gonna cause birth defects or mental illnesses in my baby. It's been a huge source of guilt and stress during my pregnancy. I'm 18 weeks along. And for those of you, just so you know, fluoxetine and Prozac are the same thing. So these two, this is a great question, and these two scenarios really highlight a big issue for a lot of women who are pregnant with mood disorders. So when you are pregnant with a mood disorder, one of the things that has to be weighed is risks versus benefits of medication for mood disorder. What you guys need to know is that every woman, any woman walking around who's pregnant, has a 1 to 3% chance of having a baby who develops a birth defect. This is a healthy pregnancy with no issues whatsoever. There's nothing, and yet up to 3% chance of having a baby with a birth defect. Most of the medications for anxiety and depression run a 1 to 3% risk of having a baby with a birth defect. So it is basically the same risk as just walking around. So most people don't realize that. What most people also don't know is untreated anxiety or depression runs a higher than 3% risk of complications during pregnancy, including miscarriage, preterm birth, stillbirth, babies that are small for gestational age, and future issues with the baby, including ADHD. So what that tells you is leaving your anxiety, your depression, your PTSD, your insomnia, your OCD, leaving these issues untreated actually can put your baby at higher risk for issues than treating them with medication. Now, there are medications that you're not going to want to use if we can help it. So one of the examples would be most of the mood stabilizers. Most of the mood stabilizers have a much higher risk of causing a birth defect than other medications. So that's still something that you want to make sure that you're kind of keeping an eye out for. But fluoxetine, which is Prozac, and Celexa, which is citalopram, are SSRIs. So SSRIs are serotonin selective reuptake inhibitors. They actually increase serotonin in your system. These medications are FDA approved for anxiety, depression, panic. And then depending on which one, some of them will also help you a little bit more with OCD. Some of them will help you a little bit more with panic, with social anxiety. So they're a really great group of medications. They're not addictive. They're not controlled substances. They really are very safe. The one exception is Paxil. Paxil, a long time ago, was associated with a study that showed increased risk of cardiac heart defects. That's really pretty much been debunked, but we still don't use it for a variety of reasons because, like, people are scared to, which is fine. There's plenty of other meds that are really good. So Prozac is considered safe to use even in the first trimester. So now the mom who decided to switch and then go off of medications, there's nothing wrong with that. If you're able to manage your mental health, then that's fine. That's a great choice for you. If you are a mom who needs medication, that's also a great choice. The number one treatment, the number one evidence-based treatment for women who are pregnant with a mood disorder is therapy. So anybody who's out there struggling with your mood, please, if you can get into therapy, please do so. This is absolutely evidence-based. It is so effective and can prevent you from needing medication in many times. One of the best resources out there is Postpartum Support International. If you go on their website, they have a whole bunch of different online support groups for a variety of different groups. And these support groups are free. You can just go on, you can join them at any time. And it's a really great way to create a community around you. And you can surround yourself with other pregnant people who are going through similar things and have similar issues. There's groups for military families, there's groups for dads, there's groups for people who have OCD, all sorts of stuff. So I definitely would encourage you to go on there, okay? And for our 5-week pregnant mama, it's one of those things that I really want you to look and talk to your healthcare provider. If you think you would benefit from staying on the medication, then that's one of the things that you should consider and do. Okay, Chanel, let's see. What about taking antibiotics and an injection in the hip, and then your body goes through a machine? So the body going through a machine sounds like a CT or a CT scan, a CAT scan, or an MRI. Antibiotics are usually, generally speaking, fine. It depends on what the antibiotic is and what it's being used for. Now, when you're getting a picture done through a machine and you're getting an injection, that is usually dye. That's dye contrast. That's a whole nother story. Some of the dye contrasts are okay and some of them are not. Now, sometimes they will need to do one of those dye contrast images using like a dye that we don't want to use all the time if the benefit outweighs the risk. If there's some kind of medical urgency that they need to get a clear picture, they'll sometimes do that. And they may also use those dyes to get a clear picture of the baby for some reason. So I think that's what you're talking about with that. Next on the list for the depression medication, we had one other person who said, what are your thoughts about Abilify during pregnancy? Abilify is an antipsychotic. It's very effective. It's used to treat bipolar disease, schizophrenia. It can be used a little bit for depression, but generally speaking, bipolar, schizophrenia. It can be taken by pill. There's also an injectable form. So it's a good medication. It's very effective. It does have some side effects that we want to be careful of, but it is a really good medication and it's used a lot. So Abilify can be a miracle drug for somebody who's suffering from severe bipolar disease. And your mood needs to be stable when you're pregnant, because if it's not, you're exposing your body to a whole bunch of stress hormones and the baby feels those stress hormones, and that can be bad for the baby. So if Abilify keeps your mood stable, it's really something that we should consider keeping on board. But now, what's the safety of Abilify? So it's really unknown, okay? So we can't do studies on medications for pregnant women and on breastfeeding women. It's not ethical because we don't know what the effects would be on a baby. So the only information we have is to gather information about the actual drug, the molecule size, the fat solubility, the half-life, as well as looking at animal studies and anecdotal evidence that's come out. We aggregate that data and then we try to make a determination of risk versus benefit and safety. So we don't know for sure. What I can tell you is studies for Abilify show that rats and rabbits who got 10 times the human maximum dose showed possible fetal development issues, including being small and bone growth issues. So we know in animals there's a potential. So what I would say is risk versus benefit. If this is the only medication that's keeping you stable, then this is something we need to consider. If it's not something that you want to, I guess, risk, or you and your healthcare provider decide that it's not what you want to be taking, then what I would be telling you is, why don't you talk about other antipsychotics? For example, Seroquel, quetiapine, is an amazing drug, and it's much safer for pregnancy and breastfeeding than a lot of other medications are. So there are other options that can be utilized. The other thing is, very specifically for bipolar disease, just because you have bipolar disease does not mean you're constantly unstable. In fact, for reasons that probably remain unknown, my guess is mostly hormones. Many women with bipolar disease will actually have their mood be the most stable in their life, even without medication, while pregnant. It probably has to do with the body's job of keeping that baby safe. So a lot of women can actually go without medication during pregnancy, and then they just start their medication up postpartum. So I definitely think Abilify is on the table. I don't think it's something that you just have to automatically say no about, but it's definitely a discussion that needs to take place. Hi, Gabriella. Is there a way to tell how far or how much you've dilated before going to the hospital? Yeah, no, unfortunately, there is not. So the only way to tell how far you've dilated is to actually have an exam, to actually have a physical exam. So if you are not pregnant, right? Non-pregnant people, do not do this if you're pregnant. And you were to stick your fingers into your vagina, a lot of women can feel the cervix, okay? You may not feel the opening of your cervix, but you can feel that there's something inside that's kind of sticking down. That's your cervix. When you are not dilated, your cervix kind of sits posterior towards the back. So you can't even really feel the cervical opening. In fact, that's why when we first examine you, especially if you're really at 0, 1, 2 centimeters, the exam can be very uncomfortable because we have to take our fingers and we have to reach back behind to figure out where the opening is and feel if there's any dilation. Now, once we do that, the way we determine is by basically sticking our fingers in your cervix. Again, why it's uncomfortable. Now, obviously, if you're closed, we're not sticking our fingers inside. We can't, okay? So this is closed, that's not gonna. But what happens is 1 centimeter is 1. So 2 centimeters kind of looks like that. 3 centimeters kind of looks like that. 4, 5, 6, 7, and then 8 is kind of like really stretching. 9, by that time, you're kind of sweeping and you can kind of feel that there's cervix left, but most of it's just a baby's head. And then 10, no matter where you go, you feel nothing but a head. That's how we tell how far along you are. There is nothing that you could do to possibly assess that. And I'm going to tell you that the other thing is we do this with sterile technique. We have sterile gloves where everything is very clean. You do not want to be putting your hand in your vagina unless you have sterile gloves, and none of y'all have that at home. These aren't the gloves you buy in a box that you open up and there's 100. No, these are sterile individual packed. Because if your water has broken and you didn't know it, if anything's going on, you could introduce infection. The other thing is, believe it or not, no matter how many times you've checked, sometimes things will catch you by surprise. I cannot tell you how many times I've checked somebody who looks totally fine, and I'm like, oh, she's going to be 0 centimeters. There's like no way. She has no pain. She's like sitting on her phone, and she'll be 8, 9, 10 centimeters, which shocks you. So you never know what you're going to find either. So then if you're not sure, it can just throw it off. So unfortunately, no, the only way to know is to be checked by somebody who knows how to do that. Chanel, how could you tell if you're in labor or if it's time to have the baby? So there is a video on that. We're going to link that into the description. One of the biggest things, one of the biggest telltale signs is that you are having cramping pain. Now, one of the things I'll tell you guys is, listen, if you're having intermittent back pain, do not dismiss that. That could be early back labor. So back labor usually happens because the baby's in not the ideal position. Baby is head down, but the face is kind of turned in a way we don't want it. So the baby will be hitting against the pelvic bone. So you'll feel some pain back there. So back labor is sometimes noticeable very early on by intermittent back pain. Another really big telltale sign is nausea, vomiting, or diarrhea. So in order for your baby to come down, your body doesn't want anything in the intestines because it's just taking up room, and we need to push a baby out. So oftentimes right before you're going into real good labor, you'll vomit or you'll have diarrhea. So that's a really good sign to get checked out. If you're having any kind of spotting, that's something that you need to get checked out as well, and that can often be a sign. The other thing that is extremely important, and you guys need to be careful of, if the baby's movements slow down or change in a way that you weren't expecting, that could be a sign of early labor. Now, for those of you who don't know this, if your baby stops moving the way you expect the baby to move, you need to contact your healthcare provider immediately. That is a do not pass go. Let them know what's going on. They are most likely going to give you the directions on how to do a kick count, which is super easy. You basically sit in a chair and you mark down every time the baby moves for a certain amount of time. That's most likely what they're going to have you do. That's fine. That's acceptable, standard practice, but you want to let your doctor know that this is what's happening, because sometimes they'll have you go to the hospital just to do an ultrasound. But having a baby slow down in movement is often also a sign of labor. Avination. Okay. Any benefits in drinking red raspberry leaf tea or using primrose oil? So the evidence goes back and forth. Primrose oil, especially if you actually break a capsule and apply it vaginally, can actually ripen the cervix. Both of those can ripen the cervix and soften the cervix up, which makes it more favorable for an induction. Okay. So a lot of us are getting induced nowadays for a variety of reasons. And one of the things that I recommend women do, and we have a video on this, is I recommend people advocate for a medication called Cervidil. So Cervidil is this medication. It's on like a flat piece of cotton, and it looks like a tampon, except a flat tampon. So the cotton has a little tail. And what we do is we slide it next to the cervix, and then the medication infuses into the cervix, right? And then what it does is it softens the cervix. So this cervix is long, thick, closed, right? This is what I keep saying. Well, if you guys were to feel your cervix inside, again, if you're pregnant, don't do this. But when you're not pregnant, feel inside, it kind of feels like my fingers. Like it's a little bit softer than my fingers, but it kind of feels like this padded part of your finger. It's pretty firm. And now remember, so when you're contracting, right? So this is your cervix. The contractions are designed to pull this cervix up. And as it's pulling it up, it's thinning it, right? And so you see, so it goes from thick to thin and then open. That's what the uterus is doing. It's pulling, okay? Now, imagine if you have something as stiff as my fingers, that's going to take a lot more work to get softer and willing to like open up. Now imagine if you have something as soft as Jello, which is kind of what a really ripe cervix will feel like. Like it's really, 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 really soft. And so when you have this really soft, kind of squishy like cervix, adding a little bit of like Pitocin or something like that to try to get that induction going, well, that cervix can just right open, okay? So drinking the red raspberry leaf tea and using the primrose oil can oftentimes help to ripen the cervix. Some people will take primrose oil capsules. I don't think it's as effective, but it can avoid you sticking your fingers into your vagina, which runs a risk of infection. Okay. If your healthcare provider tells you that healthcare provider tells you that you're allowed vaginally, make sure that you're washing your hands ahead of time. And don't use any of the alcohol stuff. It will burn your vagina when you touch your own vagina. At how many weeks can you start with the primrose oil and drinking red raspberry leaf tea? Okay, so my natural induction methods, which include those, and it also includes pumping, generally speaking, 37 weeks. You have to ask your healthcare provider for sure. So why 37 weeks? Primrose oil and red raspberry leaf tea, effective for some people, not effective for other people. Definitely a long haul thing. It's not like going to happen overnight. But technically, anything could happen overnight. Okay. Most of us are the textbook, but we're not all the textbook. So you could be that rare person that you take one primrose oil and the next thing you know, you're in full blown labor. And as I was speaking earlier at the beginning of the video, it's extremely important that a baby is allowed to be in your belly to 39 weeks because there's a lot of brain development that happens between 36 weeks and 40 weeks. So we want to make sure we're keeping you pregnant up until that time. Now, as much as I love those two things, I think they're like okay. They help some, but I prefer pumping. I think pumping is one of the most awesome ways to ripen a cervix. So I encourage everybody starting at 37 weeks, ask your healthcare provider. So here's what happens. Pumping induces oxytocin. Oxytocin is natural Pitocin, right? It's natural Pitocin. Pitocin is the medication we give you to contract, right? When you're having an induction and stuff. So oxytocin, when it's stimulated, will cause your uterus to contract. Starting at 37 weeks, if you're allowed to pump once a day for about 10 minutes, you can induce some natural contractions. Now, that's nice because, again, those contractions will start to ripen the cervix and pull at it. But the other thing that can happen is you can actually pump out some of that colostrum. So you can save all of your colostrum, even little teeny tiny drops. If you can see it and collect it, get it into something. Freeze it, label it. As long as it's labeled with a date, time, your name, and it's been frozen, we can use that to feed your baby in the hospital. So if your baby's having blood sugar issues, if your baby's having jaundice issues, we can use your stored colostrum to help feed the baby. Now, your baby will be at higher risk for jaundice and blood sugar issues if you induce labor and have a baby at 37 weeks. So don't go gung-ho thinking this is going to help. You want the baby to be 40 weeks if possible. But in the meantime, 37 weeks, you might be able to pump once a day, 38 weeks twice a day, and starting 39 weeks and on, 3 times a day. And this can really help to ripen the cervix. So for those of you who are joining me, just a quick hi, I'm Dr. Samantha, the maternity mentor. Please feel free to put your questions in the chat. Like a lot of our viewers have been doing, this is what I'm here for. And we will, keep going with them. The other thing is, for those of you who stick to the end, I'm going to give you a sneak peek at tomorrow's video, or I'm going to tell you what tomorrow's video is. Chanel, what if you have blood in your diarrhea? Okay, so if you have blood in your diarrhea, you need to go, honestly, you need to call the healthcare provider, or you need to go to the hospital. But that very well could be hemorrhoids. So you absolutely need to talk to them right away. You do not just sit around waiting, but it might just be hemorrhoids. Hemorrhoids are very common during pregnancy, and especially right at the very end. There's so much pressure on the rectum that a lot of times those hemorrhoids will burst open and you'll get some blood, that it could be the cause of it. And just so you guys know, we're oftentimes used to hemorrhoids being on the outside, but you can actually have internal hemorrhoids as well that you can't see. So it's one of those things that you do want to get checked out, but that could be what's causing it. So we had a really great question on, we had a couple good questions on postpartum bleeding, and I know a couple of you guys are probably getting ready to deliver. So the first one said, I delivered my baby yesterday and was discharged last night. All my vital signs were normal. I was not bleeding at discharge, but now I'm experiencing cramping in my belly, like I have dysmenorrhea. That's like painful period. But the blood is not so much. When I move or walk, that's when the blood comes out. The other one said, it's been 2 months since my delivery. My bleeding got lighter day by day, but now the last 5 to 6 days, I'm bleeding like when I have my period. Is this normal? So postpartum bleeding is extremely tricky, and it's very important that you kind of like try to understand what's going on. So the first thing is, the mom who says she's 2 months postpartum, it got lighter and lighter and lighter, and now she's bleeding 5 to 6 days, seems like her period. That's probably your period. So a lot of people think if I'm breastfeeding exclusive, I'm not going to get a period for a while. A lot of women think they're not going to get a period for a year. That is not the case. I have a lot of women who get their periods 4 weeks after delivery, and they can be full-blown breastfeeding. You need to expect your period to come at any time. One of the other things that I think is a misnomer is you need to expect from the time you deliver that you could be ovulating. That means releasing an egg every month and that you could get pregnant. For the longest time, we talked about natural family planning. And if you're breastfeeding, it's a natural form of birth control. I can tell you, I see more and more women getting pregnant while exclusively breastfeeding and not getting a period. So I'm going to tell you, our food supply is full of hormones. We're eating diets that are just not as healthy as they used to be. And if you think about it, with all that stuff that we're putting in our body, we can't help it. I mean, it's there. Those hormones may be affecting our own hormones, which means you might think that you're not ovulating and you are. And the next thing you know, you get pregnant. So you really want to plan as if you could get pregnant at any time, and make sure you're using birth control if you want to use birth control. So then, going to this mom who's 2 months postpartum, I would expect that that could very much be a regular normal cycle depending on if her bleeding stopped, okay? Now, if she had kept bleeding the entire time and all of a sudden the bleeding gets worse again, that's considered like a medical emergency. You need to go to the hospital and get checked out because we don't know what's going on. For the mom who was postpartum and released home, who's having pain, but not really seeing bleeding except when she walks around, that's something else that I would also be calling the healthcare provider about. Now, a lot of women will bleed really heavy for the first 24 hours, and it's like all of a sudden the bleeding's just so much better or gone. That does happen. When you stand up, having gushes of blood is also kind of normal, and I would think that was okay. But the pain that she's kind of describing is something that you want to make sure is okay. It could just be the normal cramping from a uterus, but because the pattern's kind of odd, you want to be sure that you keep an eye on it. Now, the other thing I want to let you guys know, your bleeding starts out and it's really heavy. Like the first day, it's like super duper heavy. And then like days 2 to like 5, it's like a heavy period, okay? So you can fill up most of a pad sometimes every time you're changing, but then it gets lighter and lighter and lighter. It should never go back. Now, if you're 7, 8 days postpartum and you're having really heavy bleeding with lots and lots of blood clots and pieces of blood and all sorts of other stuff, and your milk supply has not come in, you want to call your healthcare provider immediately. That is a sign of a retained placenta, which is one of the most common causes of a postpartum hemorrhage once a mom goes home. Okay. Postpartum hemorrhages that happen in the hospital happen for a variety of other reasons, but a hemorrhage that happens at home is usually caused by a retained placenta. And one of the things that can be a key to that, to understanding that that's what's going on, is actually your milk supply not coming in. Because the way to make milk is through a hormonal process that only happens after the placenta detaches from the uterine wall. And if a piece is still in there, then that hormonal situation didn't happen. For those of you who are joining us, please feel free to put any of your questions into the chat. I have a second trimester bleeding question. I'm 5.5 months pregnant. I have slight yellow discharge and it's semi-liquid in form. I also noticed 2 to 3 spots of bleeding. I can feel the movement of the baby. Is this a serious concern? I'm visiting the hospital tomorrow. All right. So anytime you guys have bleeding, you call the healthcare provider, you go to the hospital. Period. End of conversation. There is plenty of reasons why bleeding is normal, but you don't want to take a chance because there are things that could be medical emergencies that we can also treat and stop it from becoming a medical emergency. However, yellow discharge is not good, and that is usually a sign of an infection. So we have a couple videos on STDs that we're going to link into the description. So many of the sexually transmitted diseases are associated with a yellow discharge. There's also a couple other infections that are not sexually transmitted diseases that can also cause a yellow discharge. Infection is the number one cause of miscarriage, stillbirth, and preterm birth. You cannot ignore infection, okay? If you are not sure what kind of discharge you're having, please let us figure that out for you. What do? You come in, we take a sterile Q-tip, like a cotton swab. We're going to take a little bit of that discharge. We're going to send it to a lab and we're going to test it. We can figure out if it's urine, if it's semen, if it's normal vaginal fluid, if it's some kind of secretion from a sexually transmitted disease, if it's amniotic fluid. We can figure out what it is. Once we know what it is, we can tell you how to treat it. But an untreated sexually transmitted disease, an untreated yeast infection, an untreated urinary tract infection, these can cause serious issues for you and your baby. And urinary tract infections being the number one. So we had another question kind of going along with this on urinary tract infections. I'm a little prone to UTIs. I had a UTI in my first pregnancy, which was asymptomatic. So she had no symptoms. She went into spontaneous labor when my cervical cerclage failed. A few doctors said that it might have happened due to the infection. Her babies didn't survive. Now she's 1.5 years later and she's 6 weeks pregnant and she's been having recurrent UTIs for the first month of her pregnancy. The bacteria has been changing and I'm losing my mind. The urinary tract infection is not going away. I'm scared of losing this pregnancy. My gynecologist prescribed Niftas, yet no help. They gave me fosfomycin for a day, yet no relief. I'm drinking 5 liters of water, cranberry juice. I practice all the hygiene necessary, yet it's not going away. Is there any chances of having a UTI and carrying to full term? So this is the exact example of why we want you guys to come in and get checked out and let us figure out what's going on and get treated. Now, she's clearly getting treatment. When we identify an infection, if it's bacterial in nature, we're going to be giving you antibiotics. Antibiotics are essential in this treatment. One of the biggest issues is when a woman gets any kind of medication during pregnancy, she often doesn't want to take the medication. She's worried about the harm it'll cause the baby. Now, when we have a bacterial infection, she'll start antibiotics, and within like 24, 48 hours, she feels better. So she stops the antibiotics. This is one of the biggest, most deadly mistakes you can make. So imagine that the bacteria is an army, okay? And you're going to fight this army with these antibiotics. You're bringing the antibiotics in to fight off and kill this bacteria. Well, as you start to take the antibiotics, the front line can't handle it and they're gone. You get rid of those bacteria. But all these guys in the back, they're watching what you're doing. They're looking at that antibiotic. They're saying, what is the chinks in the armor? How can I defend myself from this? So you're taking and you're knocking out bacteria and you start to feel better because there's less bacteria. So you're like, okay, you know what? I'm feeling better. I don't need this anymore. The infection must be gone. So you stop. But all these guys in the back, they paid attention the entire time and they built a wall. Okay. Now, once they have their wall up, they start calling for reinforcements. And now you have more bacteria. So you start to feel worse again. So what do? You're like, well, I have these antibiotics. I should have taken them. I'll finish taking them. But now there's a wall up. Those antibiotics don't work anymore. And now you get sicker. And on top of it, we don't have the same medications to use to treat that because they're now antibiotic resistant. If you've ever heard that term, that's exactly what it means. It means that they've built a wall and we can't get through it. So now we need to use stronger and stronger medications, and some of these may not be safe for your baby. Now, if you have treatment-resistant urinary tract infections, you need to ask to be seen by a maternal fetal medicine physician. These are the high-risk specialists that help treat women with complications. You also want to be sent to a urologist and to an infectious disease specialist. These are the guys that are specializing in treating this infection and figuring out what antibiotics might work for you and the baby. For those of you who heard her comment, one of the things she mentioned is that she is drinking lots of water, absolutely, and she is drinking cranberry juice. Now, just so everybody knows, cranberry juice does not treat a urinary tract infection. Don't care what you've seen. I don't care what you've heard. I don't care what evidence you think you've read. It does not treat an active urinary tract infection. That will not happen. Now, what does cranberry juice do and what does it do very well? If you do not have an active urinary tract infection, cranberry juice acidifies, makes the urine acidic. That can discourage bacterial growth. So it can stop the bacteria from being able to grow as much because it's not a great environment for them. So you want to make sure that you are just understanding that if they've prescribed you antibiotics, you need to take those. Cranberry juice is not going to treat that. All right. So For those of you guys who are still here, please make sure to put any questions you have in the chat. I'm finishing up. I have one last question. And it came on the miscarriage video. Does baby aspirin prevent you from having a miscarriage? So I do have a video that I just put out on baby aspirin. We'll link that. Baby aspirin does not prevent you from having a miscarriage. We have used it for a little while because there's some thoughts that some women who are having recurrent miscarriage may be due to a clotting issue, and baby aspirin does help to reduce blood clots. So the thought is that if you are taking baby aspirin, it might reduce those blood clots, and therefore it might be something that would help you from having a miscarriage. But there's not a lot of evidence to say that's going to happen for sure. So it's just kind of one of those things that some doctors will use it and some won't. But please take a look at the baby aspirin. It's extremely good at helping with women who are at risk for preeclampsia, and it can be a life-saving supplement. All right. So that's all the questions I have from the video. So if any of you guys have any last-minute questions, let me know. I want to thank you guys for joining me. I am here every Monday at 9 p.m. Eastern Standard Time to answer your questions live, to answer questions you put on the videos. Please share the channel with your friends and family. Please follow us on our social media. Please like and subscribe to the channel. That really helps me out. When you're asking questions, I'm the one who's looking at it. So listen, if you guys have suggestions, like Gabriella asking for a video on Cervidil, which I will try to do hopefully before Gabriella delivers, then that's what I want to hear about. I want to hear what you guys have to say, what you guys are interested in. A lot of the videos that have come out recently are direct suggestions. So please feel free to let me know. Now, tomorrow's video was kind of like a brainchild of mine. It's one of a two-part series. So the two-part series is actually on cosmetic procedures and beauty treatments during pregnancy. How many of us go to get so many things done and we want to wonder, is it safe or not safe during pregnancy? And why might it be safe or not safe? So in tomorrow's video, which is the first part, we're going to actually talk about laser hair removal, waxing, Botox, and different things. So I want you guys to check it out. I think it's going to be very exciting to really hear about those things and see whether you can still do some of that stuff while you're pregnant or postpartum. You're welcome, Gabriella. My name is Samantha. I am the maternity mentor. Thank you so much for joining me on this Monday night. I really, really appreciate all of you. And I look forward to talking to you next week. Bye for now.